Sometimes I'll see patients that'll come in with a story that they've had various symptoms for many years. They've seen a few other doctors, not necessarily rheumatologists. A diagnosis has never been made, and things have been slowly progressive. Maybe they've done some additional reading, or they've typed their symptoms into their favorite AI program, and it said you could have this condition or that autoimmune condition, and now they're finally seeing a rheumatologist, and they're surprised to learn, hey, they could actually have an autoimmune condition. Why does that happen? This is Dr. Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. An interesting thing happens in every rheumatology clinic. You do see these patients that come in with these stories where they've had some symptoms, they've kind of bounced from physician to physician, and nothing has really quite stuck, and they're a little bit of a diagnostic mystery. Now, some of those people don't actually have a diagnosis that even the rheumatologist can give, but sometimes we actually find things and we can actually help to explain what's going on and give them a diagnosis, some certainty as to what's going on, and then some guidance in terms of how to manage that and treat that. And it seems a little bit magical, like how did you pull that rabbit out of the hat? But there's actually some good reasons for that. Okay, number one, at least to sort of give some credit to rheumatologists. We are used to seeing conditions that can sometimes be a bit of a diagnostic mystery and a diagnostic dilemma. And we're used to making medical diagnostic decisions in a bit of ambiguity, meaning maybe you're not a textbook case, maybe not all the pieces fit, but enough do where we can actually come to a diagnosis. And maybe there's some additional testing that we're aware of that a lot of our colleagues outside of rheumatology are not, that kind of helps to seal that sort of decision making. And that's not just based on experience or a field that dabbles in the black arts a little bit. It's that we even have diagnostic criteria that fits that. So for example, ankylosing spondylitis is a condition where your immune system is causing inflammation in the spine. We know that not all of our patients will actually have imaging evidence of that. So much so that we actually have a condition called non-radiographic spondyloarthropathy, which means that you have this inflammation of the spine and similar condition, just your imaging is not quite showing it. That's not just, again, the black arts. That is actually based on some biopsy evidence that some patients do have inflammation. And so there's a whole set of diagnostic criteria that make it appropriate to give that diagnosis. And so the field itself is built around understanding that sort of ambiguity. The other part to this is a bit unfair to some of our non-rheumatology colleagues, which is that they've done the hard work. They've actually looked at all the other possible things. Some autoimmune conditions, when you look at what else could this be, there may be 20 different other conditions. And sometimes those conditions can be severe things like cancer or blood disorders or chronic infections. And it's possible that you've actually had 20 different things already ruled out by these other doctors. And by the time you come to see the rheumatologist, you've literally ruled out 95% of the things that could be on that list. And you're left with just a few other things, in which case now the rheumatologist sort of, rides in to save the day and is able to say, oh, here's what's going on, because you've ruled out everything else. And there's really only one or two other things that can still be there. So sometimes when you have a disease course that seems a bit meandering and it seems a bit hopeless, and now you're finally seeing a rheumatologist who can put things together, there's good reasons for that. There is hope that we can still help out. I don't think all of our patients who come in with those kind of stories will get diagnosed by us, but enough will, where sometimes it seems like the rheumatologist is a bit of a Sherlock Holmes here, a diagnostic sort of genius, and it's good to be able to help patients in that regard as well.